I started the center back in 2001 after discussing this idea with the wonderful parents of a little girl that I had been diagnosed with celiac disease. They were generous enough to listen to me and to actually donate their money, their time, their talents in creating with me the center. We are really now have reached a level of visibility in the country. We are going leaps forward with the research component, which is actually one of our most important strengths, thanks to the presence of Dr. Jabri, who leads our laboratory with cutting-edge research on celiac disease.
The research at the University of Chicago is unique. What makes it unique, I would say, is the people who are gathered together. The fact that you have a very strong pediatric section on celiac disease, an adult section that takes care of celiac patients, and a strong research component, and that all the three components work together.
Although many doctors in this country are not informed about it, celiac disease affects more than 1% of the population. So we really need to educate doctors, to have it on their radar, to screen people for the disease and get it properly diagnosed. The University of Chicago Celiac Disease Center offers a full range of services. We offer patient care to both the pediatric and the adult population.
We have been servicing incredible numbers of celiac patients in a different number of ways. Directly by providing the gluten-free gift basket at the time of diagnosis. By helping them with proper diagnosis, we respond daily to calls, emails that are flooding our office.
We do advocacy work through the American Celiac Disease Alliance in Washington. We offer educational services to patients, lay people, and medical professionals. Our education mission is foremost and prevalent, and we pursue that tirelessly with conferences, with updating our websites with newer and correct information on celiac disease, spreading the word any way we can, and we are providing help with all our energy. It's a very exciting time for people with celiac disease. As you can see in industry, gluten-free foods are getting better tasting and there are more choices out there. But at the University of Chicago, we are really working to take it beyond living with the disease and managing the disease. We would like to eradicate the disease. And Dr. Jabri and her team are working to create a mouse model. This mouse model is the first step in unlocking untold breakthroughs. You have to create a model in which you reconstitute all the genetic background and in which you also create the necessary environmental factors leading to the disease. So in a way, it also tests, what we think is going on in human and pinpoints the targets for therapy that we should develop in celiac disease. So having a model that fully develops the same condition that celiac disease has would be fundamental for us to be able to actually tease out what are all the factors that come into play in celiac disease and how to best interfere with them and stop them. So I really think that creating a mouse model is one of our biggest challenges and one of the most ambitious projects we could ever conceive. The very first national conference on celiac disease will be taking place in Chicago in a few months. In 2013, we'll be hosting what will be the 15th World Congress of Celiac Disease. So that, once again, is an outstanding recognition of the excellence of our center, of which I'm incredibly proud of. Back in 2001, when Dr. Guandolini started the University of Chicago Celiac Disease Center, he couldn't imagine how far we've come. We have you to thank for that. Through your time, talents, and financial contributions, we are now one of the most prominent centers in the world. We have more and more ambitious goals in our future, and therefore we need your individual support ever more. Our research team is on the verge of a huge breakthrough in celiac disease, and possibly vaccines and even a cure. We have a sense of urgency about us. We're so close to finding the answers. With your help, I know we can get there. For me, the most exciting possibility is to develop that vaccine, because again, when you think about the children and you think about how it can impact their life, for me this would be a wonderful step forward.
how would I personally feel after we have actually reached our ultimate goal, which is to solve the dilemma, the mystery of celiac disease and gluten sensitivity, having gone to the bottom, having unraveled the mystery and being able to offer to the world a solution to celiac disease? That would make me feel the most accomplished person in the world. This would be the most magnificent recognition I could even dream of, better than Nobel Prize, if I may. So I want to say really from the heart, thank you to everyone who has made this possible and who will continue to make for us possible to believe in this dream.
Thank you.
Thank you.
Thank you.